Hari Om.
Hari Om.
Hari Om, Neelam ji.
Hari Om, Sangeeta ji. Hari Om, everybody.
I see Vanita ji also logged in today.
Yeah, early on. So when I start the opening prayer,
We can start.
we'll do the maybe couple more minutes. Could we give Hari Om? Could we give couple more minutes for people to join? I feel like people are all coming in. Maybe is that okay, Medha ji? Couple more minutes.
Sure.
Hari Om, we'll start in couple more minutes. We are giving time for participants to join us. So it's 2 minutes after 5. So we can start. I'm Sangeeta Bala, and I'm very happy to welcome all of you to another Vanaprastha program on behalf of all our panelists and team today. Vanaprastha program is an unique, innovative, and a practical service for seniors of ages 55 and above. It is geared to help seniors to find a harmonious balance and remarkable strength through spiritual evolution. Before I announce the sessions in our program today, I would like to begin with our Chinmaya opening prayers. Om Sahana Vavatu Sahanau Bhunattu Sahaviryam Karavavahai Tejasvinavaditamastu ma vidvishavahai. Om Shanti Shanti Shanti. Vakratunda Mahakaya Surya Kodi Samaprabha Nirvignam Guru Medeva Sarvakayeshu Sarvatam Samasta Jana Kalyane Niratam Karunamayam Namami Chinmayam Devam Sadgurum Brahma Vidvaram Sadgurum Brahma Vidvaram. Hari Om.
Hari Om.
So we have 4 invigorating sessions today. The first session will be presented by R. Medhaji. Medhaji is a retired scientist. She has done 2-year course in Vedanta at Sadipani Sadhanalaya. and she is going to be taking or talking about graceful aging today. Medha also takes 3 other sessions during the week, and I'm going to give you that information. On Tuesdays and Wednesdays, Medha is talking about application of Upanishads in daily life at 8:30 p.m. And on Fridays at 8 p.m., empowerment from within. So I welcome Medha to lead us in the Vedanta session. Hari Om, Medha ji.
Hari Om, Sangeeta ji. Thank you. Can you hear me well, everyone? All right. So welcome back, everyone. I see some of the faces. I see some of the names here. So they are, like as our Swamiji says, they are in gross body here somewhere, subtle body somewhere. Hari Om, Hari Om. I don't mean to ask you to turn on your cameras, but it just helps to see the faces. That way I know how to change my strategy of talking, because sometimes if somebody is yawning, then I know, oh, this is not working. I need to tell in a different way or something like that. Only from that angle, I usually like to see people's faces. And being on Zoom now, that's how it is different. Otherwise, in person is very different too. So anyway, welcome all, and welcome for the third session of Vanaprastha series that we have started again, which we were doing before the COVID started. So welcome back. And those I see the faces, familiar faces, I'm going to have a quiz. What did we do last time? And I will stop at that. I won't go further. I will just make you think, what did we do last time? So that way you think, oh, 1 month back, something about Vanaprastha she mentioned, something about graceful aging she mentioned. So I will review that in the beginning, and then I will go further with some more practical tips, what to do in Vanaprastha. So I always say in the Devi groups that I have, or in adult sessions, I say, for these Vanaprastha sessions, actually Grihastha should attend more. That way they are preparing what they would be doing, or what they would be doing 5 years down the road, 10 years down the road. So I always recommend Grihasthas more to attend. Vanaprasthas also, certainly yes. But if they start earlier, then as I say always, landing gear. We know when to add the landing gear, and after that what to do. So I'm going to touch on certain points in Vanaprastha, what we could do. Okay, so that would be one of the main themes today. So I'm going to show some slides, and I will take questions at the end also. Okay, now what is Vanaprastha we have seen? Vanaprastha, it could be simply is called as retired life, but actually word by itself, it could be translated as Vanaprastha, going to Vana. But nobody goes to Vana these days. So what does that really mean? And in today's context, there is no Vanaprastha. Student life is there, Grihastha, and then that's it. There is other 2 ashramas we don't get to see much. So what are the scriptures indicating what Vanaprastha should be? So I will start with all 4 ashramas quickly in a review, and then I will elaborate more on how to change or what to change from Grihastha to Vanaprastha, what needs to be done. So these are the 2 main points I will try to cover. So I will bring my slides first, because I'm sharing 4 ashramas in a nutshell. This kind of we have done last time and a time before, but if we take our scriptures as scriptures indicate, our life has 100 years, roughly 4 ashramas are divided into 25 years each. Okay, so first one is Brahmacharya, as we know. It is the student life 100% of the time is recommended or should be involved for learning. So this is the learning stage. If you want the Sanskrit word as Guruji is using, Shiksha. This is a time for Shiksha where we are learning discipline with values. So that is expected in the student life, learning discipline with values. If you want Sanskrit words, not that you should write down or note, but those who want the Sanskrit words, it is Samskara Yukta Anushasanam. Samskara Yukta Anushasanam. So, learning discipline with values. All right, 25 years, all student life is done. Now they enter Grihastha. So, they are doing more earning. And this is supposed to be up to the age of 50. And in that, what is a recommended activities that should be done? 75% of the time should be devoted to performing your duties, and 25% should be reserved for your personal sadhana. So Grihasthas, we have to make a note of this, that not everything is extrovert activities. Sometime at least we have to concentrate on ourselves, on doing our own sadhana. So this is earning, or Guruji says the word Diksha. Whatever we have learned, now we are practicing that with right thinking, living with right thinking. Now this is supposed to be up to age of 50. Now in modern times, it is not practical, we know. So maybe 60 or so. Then next phase comes, which is Vanaprastha. So majority of the time was extrovert, 75% outside. Now we need to do a switch. We need to do a change. We need to make a turn. And instead of 75% outside activities, 75% should be personal sadhana. We are making a turn inwards, as we have been saying in the past 2 sessions. And only 25% of the time for the outside other activities, whatever social activities we want to do. So majority of the time should be for personal sadhana. And as Guruji calls it, this is a time we are living on bhiksha, not really begging food, but content with whatever is coming our way. So that should be our attitude. If it comes, I'm happy. If it doesn't come, still I'm not dejected. Whatever comes my way, that's how I'm going to live contented life. So it is living with dispassion and performing scriptural studies. If you want the Sanskrit words, it is Vairagya Yukta Shastra Adhyayanam. Okay, this would be up to 75 age. And then last is Sannyasa, where there is no return. 100% of the time is spent on sadhana. So from 75% personal sadhana, 25% outside activities were kind of allowed by the scriptures. Now nothing, no more outside, all the time reveling in the Brahman, renouncing the world, external world. Now, whether that is practical or not, we'll discuss that later. Currently, we are going to concentrate on this Vanaprastha stage, how to make a turn inwards. That's what we are going to talk about. So, it is from this Grihastha, how do we make a change to Vanaprastha? 75% outside activities to only 25% outside activities, and 25% personal sadhana to 75% personal sadhana. What does that mean? What should we do? Some practical tips I'm going to give. Now, this is a big change. Being extrovert, being involved in so many activities and turning inwards. So that's why we need a lot of preparation. It cannot happen overnight. And I always remember, I might have mentioned this earlier also sometime. My supervisor, few years back, she had said her husband is planning to retire, but he has no plans what to do. And she said, it's going to be a disaster at home, I know, because he has no plans. He's planning to retire, stay home, and then, I don't know, he will drive me crazy. So that should not happen to us. Then we retired, we are not doing external activities. Now in inside at home, we are driving crazy people around. That should not happen. So what we should be doing? So first of all, we need to make a change. All right, I agree. But why should I make a change? As I mentioned, for our own health. We better agree sooner or later, our abilities are changing as we age. We cannot do the same things as we were doing at the age of 25. We know that pretty well. Jaiji can say the yogasanas, oh, at the age of 25, oh, somebody does it, and then doing with at the age of 50 or 60, we know how things are. So we have to be grow or change according to our age. Also, for our long-term happiness, this is very important. And most importantly, for living with harmony and peace in our family and around friends. Otherwise, empty mind is devil's workshop. So I have retired and I have so much free time, and then I'm just bothering all the people calling, hey, how are you doing? Especially in the COVID time, we cannot go in person. So making several just phone calls and then bothering somebody else. We should have a purposeful, meaningful, and satisfying life. That is the most important part. So how do we do that? Certain tips I'm going to give. And one reason is why we should change? Just because scriptures say so. Scriptures have recommended it, so we should follow. And we don't see many people doing around Vanaprastha, but we can be the role models. We can start. So how we can do this? A question to everyone. Who wants to change? First of all, who wants change? Everyone wants change. Who wants to change? All hands have gone down. Good. I see Sangeeta ji, Gomati ji, they are raising their hand for who wants to change also. But we want change, but somebody else should change, not me. I would be like this, you adjust according to me. So should not happen. So we can bring conscious transformation in ourselves by our own choice once we are convinced of its importance. So we have to understand the importance, why I should change, why I should go in Vanaprastha, how that would be a peaceful, meaningful life for me. Okay. So change is always hard in the beginning, but it is messy in the middle also, but gorgeous one at the end. So yes, it would be hard in the beginning, but we have to do it because this is good for us in the long run and for people around us also. And that's why we should do it too. So how should we do it? With baby steps, small steps, with firm conviction and perseverance. And there would be individualized plan. No one plan fits all. Like towards the end, well, before I retired, there is this coming, personalized medicine is coming. Even medicine, not one medicine or medicine plan would fit everyone. I don't know, Sangeeta ji is sitting there, I should not say 500 milligrams Tylenol 3 times a day, not for everyone. Somebody else needs some other kind of a medicine. So individualized plan has to be there, and I'm going to give you some suggestions. Guruji has given, Guruji Swami Tejavananda, in his book called as Graceful Aging. He has given guidelines for Vanaprastha to practice, and this is the 6th. So there are 9 devotions explained to Shabri, 9 Navavidha Bhakti. And this is the 6th one. And Guruji is saying this 6th Bhakti or devotion type would be very useful for Vanaprastha to follow. So what is that? Shata, Dhamma, Shila, Virati Bahukarma, Nirata, Nirantara, Sajjana, Dharma. And I'm going to explain that in next few minutes now. Shata is the 6th one. Shata is the 6th one. Dhamma is one quality I'm going to explain. Shila, character. Okay, that I need not explain that. Birati Bahu Karma. Birati, withdraw from various activities. Karma, action. I will explain this. And the next part, Nirata, Nirantara, Sajjana, Dharma. So this would be Dhamma, I will explain. Birati Bahu Karma, I will explain. and Nirata, Nirantara, Sajjana, Dharma. What does that mean? I will explain. So these 3 points I'm going to explain now. Okay, so what are we talking about? That we are withdrawing from the outside world, 75% outside activities to 75% our own personal sadhana, and only 25% outside activities. So we have a lot of free time. What should we do with that time? That's what we are discussing right now. So that is 3 points: Dhamma, Birati Bahukarma, and Nirata Nirantara Sajjana Dharma. So I will explain those now. Dhamma is sense control. Dhamma is sense control, meaning all our what we eat, what we hear, what we speak, what all our activities that you have been doing. So healthy diet is one of the very important part. What I eat and any input, not just through mouth, everywhere. What is my input that has to be healthy? Okay, so that's one, having Dhamma, sense control, and then doing appropriate exercise. Some exercise is necessary, but not something wrong. Otherwise, this hurts, and then next 2 months we are not able to exercise at all. So appropriate exercise is necessary so that we are keeping our body fit. Okay, so body is kept fit. Then the next one is Birati Bahukarma. So withdrawing from excessive worldly activities, that is important. So now outside activities are removed, less they are there. Now we are left with a free time. As I mentioned just now, my supervisor said my husband is going to retire, but he doesn't know what he's going to do. That should not happen. So pursuing some hobby, just some points I'm suggesting, or volunteering at an organization. So you are using your time appropriately. And the most important part, as Guruji has mentioned, Nirata, Nirantara, Sajjana Dharma. Follow or engage in activities what saintly people have done or performed. For example, scriptural studies. It is suggested that we study 20 minutes some scripture, not necessary any Upanishad or anything, whatever you like. We have Mananam series. You pick one book, Mananam book, read 20 minutes, reflect on it 20 minutes, and write it down whatever you have understood. This is how Guruji has recommended doing it. Read, reflect, and write down. So pick one book. You can take any Mananam book that comes, go through that article, reflect on it for 20 minutes, and then write the points what we have understood. Living with dispassion, as we said earlier, then attaching to the higher, meaning once our goals become higher, the other activities, they start getting less and less. That also we discussed earlier. And then being content, and also very important, doing sadhana, japa, meditation, being in satsanga is very important. So again, one more time, I will give you the hint. I think my time is almost there. Yes. So this I will do next time. What we invite that also. I will leave you with this Ramcharitamanas Chaupai that I have just quoted. Chata, Dhamma, Sila, Birati Bahukarma, Nirata, Nirantara, Sajjana, Dharma. So these 3, if we follow, then as Guruji is saying, we would be able to glide into Vanaprastha. Now it is very difficult, as we discussed earlier. Any change is difficult, and that's why we need a lot of preparation also. Okay, I will take questions at the end. I think now next one is Jayji, and Sangeeta ji can introduce. Thank you so much for your attention. And remember this 6th devotion that was given to Shabri by Sri Rama. Hari Om.
Hari Om. Thank you, Medaji. Now the next session is our yoga session, and it will be led by our JG. And JG has been a long-time member of Chinmaya Mission. He's been a volunteer, sevak, spiritual seeker, and his interest is now focused on yoga. He's been teaching yoga at the mission, and with the COVID, he's now giving regular online sessions. And now I would welcome JG to lead us in our yoga session. Hari Om, JG.
Hari Om. Dinesh ji, can you make me full screen so everyone can see when I demonstrate the practices? Or individually you can do as well. If you pin me, you will see the big screen. I'm going to...
You can make JG your speaker view, then you will see JG in your big screen.
All right.
Yeah, I think individuals can make them in the top right side. If you look at your Zoom session, there's a view option there. If you click that one, it has a speaker view and gallery view. If you choose speaker view, then a JG will be on your full screen.
Yeah, I also made it a speaker view, so hopefully you all see me full. The reason is I want to demonstrate. Today I want to spend more time in practice. We have been talking about the importance of pranayama, how to practice, and the specific practice that I learned from a teacher who came from India about 6-7 years ago. And I start practicing this regularly from then after every day. And I benefited tremendously. So I would like to impart that practice to all of you. Briefly, few things about pranayama. It is very difficult to control our mind, emotions. But if we can regulate our breathing, our mind will be automatically come under our control eventually. So because the mind and prana are the two branches of the same tree, both stems from the consciousness. One work as the five energies, prana, apana, samana, vyana, and udana. And when we control that in a regulated manner, we are able to control the thoughts and become more aware of our activities of the mind. The biggest problems of the modern time is a restless, anxious, and agitated mind. In Ayurveda, it says, Adi Graste, Vyadi Graste.
Hi.
In
Yes,
Ayurveda,
sorry.
Adi Graste, Vyadi Grastaha. What does that mean is, if we constantly keep the mind perturbed, restless, and agitated, it will transform into different diseases, ailments, diabetes.
Yeah. How did you do it? On the cell phone.
Can you please call?
Can we mute all the participants except JG?
Okay, excellent. Thank you. Yes, so it is important to, especially in the modern time, we are so much under the stress and rushing for everything. So it's important we have to have a regular practice so that we will slowly able to maintain our own thoughts and activities of the mind. So one practice that I learned from Mr. Rajan Vakil is 3-step rhythmic breathing. There are 3 steps involved or 3 aspects involved. One is the asana, second is the attention, third is the breathing. So using these 3, that means our breath, body, and mind together, we transcend to higher realm of our existence. We are all spiritual beings having a human experience here in our lifetime. So we have to transcend into that spirit. Spirit means that which is not matter and energy. Our body is matter and energy, which is the mind, and prana is the energy side, and the physical body is a matter. We have to transcend beyond that to have a joyful, fulfilling life. So that is the intent of this practice. This will only take 10 minutes every day. I used to practice every day 10 minutes for a year, then increases to 20 minutes. After 2-3 years, I start doing 45 minutes of regular practice. Now, I will straight away get into the practice, and you can practice with me. If you are not able to sit on the floor, you can sit on the chair and practice with me. Only one posture is that we do Paschimottanasana, where we stretch our legs. So if you find a stool or another chair or something, you can stretch your legs onto that and keep it in that posture. And I will explain as we go and demonstrate so that you can follow. So I'm going to play a music and we'll practice with the music. The music will say 1, 2, 3, 5, 6. We don't count 4 because there is a pause, a slight pause between the inhalation and exhalation. And this is universal in every law in this universe. If you take a stone and throw up, before it's coming down, there is a pause between the transition, that stone coming down. When you go into a ocean, when the waves rise up, and there is a slight pause before it falls. So similarly, in our breathing also, when we can bring that rhythm, we will be harmonious with the whole natural process. So this particular rhythm will be 1, 2, 3, we inhale, 5, 6, exhale. And I will demonstrate that. Normal breathing is 12 breaths in a minute. And here we'll increase that in 3 times, 36 breaths in 1 minute. So whenever our breathing increases, our the cessation of the thought is automatic. We'll not be able to think anything because of the breathing is so fast. So that is the science behind the practice. And I instructed, I know many of practitioners who practice with me here in this group also. You can also include a mantra with the breath. So for 1, 2, 3, example, for 1, 2, 3, you see Om Nama. Exhale, 5, 6, we see, mentally you can repeat Shivaya. Om Nama, inhale, Shivaya, exhale. This is an additional thing that you can do when you get this practice more regular. So here I'm going to demonstrate. So first we'll do the inhale, exhale from the chest area. It is helpful to keep the hands. It is not necessary, but it is helpful to keep the hand here and observe the expansion of the rib cages. With that, we are expanding the lungs. Inhale, infuse the air to the lungs. Exhale, contract. 1, 2, 3, inhale. 5, 6, exhale. 1 minute, 36 count, continuous. Now I was watching some of you. This is where you have to employ your attention. Initially you are doing right and then lost that rhythm. Whenever you are inhale, the chest should come out. Exhale, collapse the chest. That is the rule. And I also see some of you are moving your body. So you should not move. Sthiram Sukham Asanam. The posture should be stable. And only the movement is at the chest area. Shoulder, not even movement in the shoulders. So as you practice regularly, you can adjust these things. Now we'll do from the navel. So you sit tall Loosen up the stomach area. Keep the little finger at the navel. This will improve the digestive organs, the functions at the Samanavayu, at the digestive organs. Same rhythm, 1, 2, 3, you inhale, push the stomach out, exhale, pull the stomach inside. 'Sometimes you feel this is 1 hour long, little difficult. It is natural, but as you practice regularly, we get attuned with that, because the big problem is the mind. Mind start keep on telling how long it is, am I doing right, doubt, and all this come. You allow it, give your own time, slowly, nothing happens overnight. Slowly, we all can get more and more deeper into the practice. Next one, we will do with Paschimottanasana. Here we'll stretch out the legs. Those of you are sitting on the ground, raise the hands and move from the lower back, where the sacrum meet with the root of the spine. Feel that movement, and eventually you'll be able to hold the toes. If you are not able to hold the toes, keep the hands at the lower leg. Make sure knees are straight. This infuse that movement throughout the body, the Vyana aspects of the Pancha Prana. If you are able to hold at the toes, you lock at the toe, raise your head up, face toward the ceiling. Now you move the lower abdomen. Inhale, push the stomach out. Exhale, pull the stomach inside. The stimulation is deeper, very good for the diabetic patients, and the kidneys and pancreas and spleen, liver, all of them get benefit from this practice. So when you are inhaling, exhaling, you will notice there is a subtle movement at the root of the spine. In the yoga, we call it as Kundalini. We don't need to worry much about that now, but it's basically infusing that energy from the Kundalini to the top of the head to the Sahasrara. Next practice, we'll take 5 shots of inhalation through the nostril, exhale through the mouth. This is for the Udanavayu. So here you take, exhale through the mouth. 5 inhalation through the nose, and then stacking the air and exhale through the mouth. 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 1, 2, 3, 4, 5, out. 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 Now do slow breathing, 5 count inhalation, which we call puraga, filling up, and then hold under kumbhaga, 5 count of exhalation, rechaka, hold the lungs without air, bahir kumbhaga. Again, this goes in a cyclic movement, 3 breaths in 1 minute. Inhale. Hold. Slowly exhale. Hold. Inhale. Hold the breath. Exhale slowly. Hold without air. Inhale. Gradual inhalation. Hold. Close the eyes. Exhale. Hold. Now the same rhythm, but the normal breathing. Close your eyes, align your breathing with the music. 1, 2, 3, you inhale. 5, 6, just drop. So you can mentally imagine you're sitting on a beach. The waves are rising up with the inhalation and it falls down. Same way, our breathing align with the rhythm. Inhale. Slowly inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Om Shivaya. Shivaya. Om Shivaya. Now we'll come back into the normal. So we stretch out the legs, hold the toes, keep the back straight. Inhale, exhale from the lower abdomen. 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6. Come back. We'll do the inhalation, exhalation from the navel and from the chest. 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6. 1, 2, 3, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 5, 6. Chest breathing. That's all for today. We don't have much time. I will introduce another practice called Swiso, which is a quick releasing the stress, which we'll do practice next time. Thank you all practicing with me. Hari Om.
Hari Om Jeji, thank you so much for that session. I'm going to be talking about pain in the next session, but I feel like having listened to Medaji and then practiced these asanas and pranayamas, I feel like most of our pains will be taken care of by now. So today in the health session, I'll be presenting some information about pain. Pain is a vast topic, so we may not be able to talk about everything in one session, and we're planning multiple sessions. A little bit about myself, for those of you who don't know me, I am Sangeeta Bala. I am a geriatric physician, a longtime member of Chinmaya Mission, also a spiritual seeker, a Vedanta student, Sevak, have been a Balavihar teacher, and I have two children who also went through Balavihar program, and I have one more. So we are a Chinmaya family. So let's talk about pain. And focus today would be more about chronic pain. Pain is very subjective, especially as we are growing older, our chances of having pain increases. But what is pain for you may not be pain for me, or what I perceive as pain may not be perceived as pain by someone else. So let's talk about some definitions or some descriptions of pain so that we are all on the same page and our thinking is on the same plane. So in medicine, we talk about pain as a distressing symptom that is physical, can influence our mood, personality of a person, and can affect our behavior, social life, and interaction. Pain is an unpleasant sensory and emotional experience with actual or potential tissue damage. And pain is very common in older adults, especially as we grow older. So in adults who are 85 years and above, 79% are estimated to be affected with some sort of pain. Relief of pain and suffering will help promote functional status and quality of life. So it's very important that pain is being addressed. Many of us may not admit to pain or report pain to our physicians and address the cause and seek treatments, but we should. So let's look at some of common causes of pain. As we grow older, we develop osteoarthritis. So osteoarthritic pain or joint pain is one of common causes of chronic pain. Degenerative joint bone disease is another cause. There's a slight difference between osteoarthritic pain and degenerative joint bone disease is that both of them happen in our joints, like the knee joints, shoulder joints, hip joint. In degenerative joint bone disease is more wear and tear of the ligaments, tendons, and cartilages around the joint. You can also develop chronic pain after surgery, so post-surgical pain. There is also nocturnal leg pain. If you've noticed, when we go to bed, that's the time we perceive pain the most. So leg hurts, so that is called nocturnal leg pain. Pain is also associated with various chronic illnesses that we might have. Shingles is one of the infection, and after that, it's called post-herpetic neuralgia or pain. So these are some of the common causes that we might come across, but the list is really lengthy. But as I mentioned, we'll be doing them in coming sessions. So what are the ramifications of pain? So who cares you have pain, or not? This is because it leads to decreased functional status, meaning our ability to perform our daily activities, even taking care of ourselves like bathing, dressing, to performing well in our jobs. Increases the risk of falls, sleep problems. Pain is one of the major causes of interrupted sleep. It also causes anxiety, agitation. In individuals with memory issues and dementia, it can cause confusion, delirium, and it causes poor quality of life. So I'm talking about chronic pain, but let's understand what is chronic pain or how chronic pain is different from acute pain. When you say acute, in medicine, this terminology is used for sudden onset. So acute pain happens suddenly and it lasts only for a short period of time. And it's linked with a specific body insult or injury. And the pain improves once that tissue heals or injury improves. For example, even cut with a kitchen knife, it hurts and if you do sense pain or discomfort, but as that cut heals, the pain disappears. Similarly, with the fracture of a bone, similar experience. However, a chronic pain is a persistent pain. It lasts more than 3 to 6 months beyond the normal tissue healing time. So the tissue is healed. For example, the fracture is healed, but still the pain might decrease, but it persists, leading to chronic pain. Sometimes you may not even perceive the injury or the tissue may not be injured and you will have pain or perceive pain. So what do? We have to report our pain to our primary care physician and have your pain assessed. Self-treatment is usually not recommended. So the cause of the pain should be assessed and your physician will assess it. One of the things that the physician will do is to ask you about the pain. Unfortunately, there is no device to measure pain. Pain is subjective also. I wish I had a device like a thermometer or a blood pressure measuring device like a sphygmomanometer to kind of, put it on your skin or a joint where you have pain and say, aha, yes, you have severe pain. Oh, not really, mild pain. So what your physician will do will ask you the location of the pain intensity. How severe do you perceive your pain? So there is a tool called numeric scale or numeric rating scale. The numeric rating scale, although it sounds so fancy, it's not really fancy. The physician, you might have heard before, will ask you, how do you rate your pain on a scale of 0 to 10? 0 being no pain, and 10 being the worst pain in your life. So 1, 2, 3 will be mild pain, even 4. And as you're moving from 4, 5, 6, it's moderate pain. 7, 8, 9 is severe, and 10 is the worst pain in your life. So once this kind of history is taken, then the source of the pain or the pain will be classified according to the source of the pain. So it could be somatic pain. That's something that we commonly perceive. It's related to your muscles and skeletons, which is, your bones, joints, and that's a pain that you perceive when you have arthritis. So this pain is called somatic pain. An example is arthritic pain. Visceral pain. Viscera means organ. So any pain that comes from an organ is called visceral pain. We perceive it as, oh, my stomach is hurting, I have a stomach ache. And it could be symptoms related to, say, constipation, which is coming from your intestinal tracts, is also visceral pain. Then there is type of pain that we don't know why we get it. We don't know. It's all over. It's here and there. An example of that is fibromyalgia. It's poorly determined and it's poorly diagnosed too. So I just added it here as an just to introduce you to what that may be. We probably would have to do a separate session on fibromyalgia. So let's look at treatments of pain. And I want to focus a little bit more, or to begin with, non-pharmacological therapy, non-drug therapy. I think we all reach out for that pill, right? We like to take a pill so that it improves whatever problem we have in our body. But we already started this program with sessions on Vedanta and yoga, which is actually promoting that. So lifestyle. I feel like I'm repeating what Medaji just said. So what is appropriate for our life and which has been said in our scriptures thousands and thousands of years ago, I feel we are talking about it in Western medicine. That's what I'm trained in, right? Allopathic, and that's what we're talking about. Important thing is lifestyle, how much we sleep and how regularly we eat, how well we hydrate, the diet that we practice, maintaining normal BMI, because your joints, it's only can carry so much, right? The more heavier we are, our joints also wear out soon. And exercise is very important. Regular physical activity has been shown, proven to decrease pain. It improves mood. If I take a walk, and I know Gomati ji will swear by it, that after she exercises, she just feels great. So it improves mood, boosts your functional status, and it also stabilizes your gait. Your gait is very important because if your gait is not proper, it increases your risk for fall. And then fall leads to injury, and injury will lead to acute pain, and then it can go on to chronic pain. Yoga. Actually, I would be discussing with JG later on to help us to do some asanas that might help pain later on. Tai Chi, water aerobics, and swimming are one of my favorite exercise. Swimming is somehow it's a wholesome exercise. It is resistant training. You're in water, it's like hydrotherapy. It's very relaxing. And it's also aerobics. When you swim, you also expend a lot of energy and calories. So it's also wholesome. It helps with your breathing and expansion of your lungs and joints. And like I said, it's like hydrotherapy, and it's so helpful with pain. If you don't swim, it's okay. If you don't want to do water aerobics, it's okay. If you can get into water, I know it's hard now, but if possible, if you can get into water and even walk up and down the swimming pool, where it's 3 feet is also recommended. Well, all this can happen after, when the COVID social distancing and lockdown gets better. The other things that we can do that are not related to taking a pill will be massage therapy, acupuncture, heat and cold therapy. Heat is very good because putting a moist heat over the painful joints is very helpful in calming the pain. So that's how the heat receptors and the nerves that go to your brain is shared by the pain receptors or the pain pathway. So if you put a heating bag, it actually is so soothing. It doesn't remove pain, but makes the pain more tolerable. If you have inflammation of your joints and they're very angry and red, if you put a cooling pad or ice, that helps to bring down the inflammation and thereby actually help the pain. So you can actually do alternating. Supposing you have chronic arthritis and your joints are hurting and you have this one knee is bothering you, you can put heat, say for 20 minutes, and then take a break. Putting heat for a long period of time is also not advisable because it can cause local irritation and burns. So 20 minutes, not more than that, and then take a break. Then after a couple hours, put ice for another 20 minutes, then take a break. There is no prescription for how frequent and often you want to put it, but try not to put it more than 20 minutes at a time. And you can alternate heat and cold. And cold is only useful when your joints are inflamed. The other things that you can do other than taking a pill is putting something topical on your uh, area where it hurts. There's so many gels and creams and ointments or even patch in over the counter, also by prescription in the market. One of the most effective cream or substance that you can put topically is capsaicin. This is a extract actually from chili peppers, and it's an asper cream, and you can use it by direction. But when you put these topical creams, be very careful that you don't develop some allergic reaction or contact dermatitis. Most of these creams, especially as the capsaicin or the asper cream or rubifaciin, mean they actually produce heat. So similar to putting a heating pad, these creams are producing heat. Just the opposite, the cold cream or your menthol cream. If you put in a biofreeze or menthol cream or menthol gel, if you notice, if you put it on your joints, if you have tried, you'll feel cold. These actually help with minor aches and pains. And whenever you are using these gels, always check with your physician. There is also Diclofenac Cream, which is actually a non-steroidal anti-inflammatory drug, which is in the form of a topical cream that you can put it on locally on your skin. The advantage to that is you avoid the side effects of the same drug that you will take as a pill. There is also lidocaine patch. This is usually an anesthetic that you can use it's most effective in addressing nerve pain rather than somatic or musculoskeletal pain, which is your joint pain. And all these drugs that I'm talking about are available over the counter. However, please check it with your physician before you start using it. And I'm going to touch base on the medications that you can take for pain. Medications are always looked at as a ladder. The recommendation is always to start with acetaminophen or Tylenol. One of the safest option that you can have for pain is that. So acetaminophen, use the directions that's there over the counter. but I will make recommendations. Do not exceed more than the recommended grams per day. Usually it will say 4 grams per day. But as we are getting older, we get even more conservative. So recommendation is do not exceed more than 3 grams per day. So I usually recommend for my patient, if you want, you can do extra strength, even take 1 gram, but do it only 3 times a day. You wake up in the morning, you need something to help your pain to start your day. Take a gram of Tylenol if needed. And then when you go to bed, that's when you'll perceive pain and it'll help you sleep. Instead of using sleep agents, take Tylenol. It helps your pain and it'll help you sleep better. And take another one if needed in the middle of the day. You don't have to do it on a regular basis. Only do it if as needed. And it's important thing is to have your liver monitored because acetaminophen is metabolized through the liver. High excess amount of this drug can cause liver failure and problems. So you should be very careful and use with caution if you're drinking alcohol and taking other medications that can also affect liver and if you have liver problems. You have to use a lower dose, 1 gram to 2, if you have kidney problems. So every time, that's why I emphasize every single time, when you're taking a treatment or a drug, you should check with your physician. The non-steroidal anti-inflammatory drugs that we love so much are like the ibuprofen, naproxen, to name a few. The Motrin, over-the-counter, and Aleve are these 2 drugs, the brand names that you may be familiar, can also be used, but the recommendation is use it only for short period of time because the side effects and the risks are higher. They cause kidney problems and they can also cause intestinal bleed, most importantly, gastric bleed. So it's best to take something, crackers or something before you take these medications and try to get entry-coated capsules. I think I'm going to stop with this because there's more drugs that we can keep talking about. In the future sessions, what I'm going to do is to take a somatic pain and talk about somatic pain separately and then go through different types of pain and different types of treatments. And I will take questions after Medaji and JG during the open mic session. And now I'm going to hand over to our Gomati ji, who will be coordinating the open mic session, coordinating the questions now. But before I hand it over, I want to give a shout out to all the women in our program today and in our session today and all over the world because we celebrated International Women's Day on the 8th of March. Hari Om Gomati ji. To introduce Gomati ji, actually she needs no introduction. Everybody in Chinmaya Mission or in Fairfax County or Northern Virginia would know Gomati ji. She's a long-time member, Sevak, I don't know, any designation you might have for her, she will have that. And we love her vigor. She's a relator by trade. She's a mother, she's a wife, sister, daughter, and she's my adorable friend. So handing over to Gomati ji.
Hariom, that's a very nice introduction, Sangeeta. Thank you so much. I want to thank Medaji and JG for wonderful sessions. Anytime I hear them, I feel like I'm already at peace. And thank you for the pain presentation. I think we all get to know more about it as we age. Very useful. Would like to have more details because I have some friends who are suffering from arthritis, and I was hanging out with 3 elderly couple last week. All of them were 80 and above, and all of them said their different types of pains. And when I heard them speak, I felt like I'm hearing only what pain, where is it, how much is it, they were discussing. I was just watching them. Anyway, if anyone else has a question, please post here in the chat, or I have my own pain question to ask. Sangeeta? Or first, let's give an opportunity. If Medaji has, for anybody has a question for Medaji or for JG, please do. Both of them have wonderful sessions. Medaji is one of the best Vedanta teachers we have. Please do join her classes. And JG has a yoga group. He teaches every day morning, free. Anyone can join and benefit from it. Other than that, any question answers, any questions you have, please post in the chat or raise your hands. We'll give an opportunity. While you get ready with the questions, I have a question for Sangeeta. I have pain in my hand. It's actually for both JG and Sangeeta. So I have pain that runs from my jaw through my hand and it runs through my right leg. So I try to do this asana JG has taught. You stretch your leg and you try to hold your toes. And every time I stretch, I have to yell out a painful cry. And then I stop. Should I do it or should I not do it? The pain does go away after a few days. But so first Sangeeta ji and then JG.
Oh, Gomati ji, like I mentioned, you have to have your pain assessed. You have mentioned to me the location and you have also described it very beautifully how severe it is. You have told me when the pain gets worse. You also kind of, I think I can understand the pain gets better when you are more in a relaxed posture. However, you have to have your pain assessed. Yeah. So but things that you can do for this is, I would recommend for you not to do anything that makes your pain worse. It could be a very healthy exercise or asana posture. JJ can second me on that, but don't do it. See, it's personalized. It's right now, the word of the day in healthcare is patient-centered or personalized care. And when I heard Medaji, we have talked about this in our Vedanta scriptures years ago, and now the West is catching up, or at least medicine is catching up. So you need to make your care personalized. So you have to first assess and find out why you're getting the pain, what is the cause of the pain, then try to treat the cause. The symptomatic treatment is probably relatively easier, right? So for you, for that, I would suggest you can, like I suggest, don't do what make the pain worse. And then if the pain is really bad and you're not able to do your daily function, Tylenol. That's the one that I will suggest. If it is not helping you, you need more help.
Thank you.
But JG.
Yeah, no, I completely agree with Sangeeta ji. The main rule in yogasana is whenever you feel uncomfortable, discomfort, you should not continue that posture. Sthiram Sukham Asanam. You should be comfortable, stable, and should be able to hold that for a certain period of time. If you are not able to do it, that posture is not for you that time. Now, there are many other practices. There is deep breathing. And what I suggest is to start with is Yoga Nidra. I tell all my participants that if you are new to the yoga, first start with the Yoga Nidra. In Yoga Nidra, we stop all doing, all thinking, just be there, which will invoke that natural, natural power to heal, the healing power it invokes. Again, people expect that to happen overnight. It will not happen. Yoga Nidra itself is a deep science. It requires time, understanding. Then you practice that, it gives a lot of benefit. For all joint pains, and another thing Sangeeta ji mentioned, we have a Pavana Muktasana, simple joint movement. According to yoga, we understand there is toxins accumulations in the joints, and low movement of prana, energy to the joints, are the cause for the pain. So that can be done later as you get a little more comfortable, take medicines and some this thing. And once you stabilize that, then you can continue to keep these practices kind of ongoing.
Thank you, JJ. Thank you, JJ. We have two questions, Sangeeta. One is easy. You can say yes or no or how. Another is from Vinodji. The first question is, Sangeeta ji, is it possible to circulate your papers? It was very interesting and would like to spend some time studying these papers, from Om Gautaji. And then Vinodji has asked, I would like to understand more about scale 1 to 10 for pain. I find it difficult to rate it when doctor asks. So that's the question for everybody. How do you rate the pain? For somebody, that pain tolerance is very high. For somebody, it's very less. How do you rate it?
So for the first question, circulate papers, I think you're asking about the information that I talked about. Right now, we are not circulating that information. I would suggest that you take down some notes, but we are going to repeat these things in other pain sessions too. But we will come up with a plan and we'll work on how we can make little pain pamphlets or little pamphlets with these information on all these sessions. You know, it could be the Vedanta session, the yoga session, and the health session. We'll make these little pamphlets and we'll see how we can distribute to our attendees. Going to Vinodji's second question. Vinodji, can you unmute yourself? Let's do like a demonstration session, if you don't mind. Vinodji, can you unmute yourself? Can we unmute Vinodji?
Okay, now yes. Okay.
Hari Om, Vinodji.
Hari Om.
Let's pretend you have pain somewhere, okay?
Uh-huh.
All right. So let's do a demonstration, okay? I'll be your physician. Can we have that split screen with me and Vinodji? If we can do that, that will be great. Yeah. Yeah, thank you. So Vinodji, I'm your physician, okay? So now you're in my office. Now you have a pain. So this is how I'll ask you. Hello, Vinodji, how are you? Where is your pain?
Lower back.
Okay. Low back, is it in the middle or is it in the left side or is it in the right side?
Left side as well as in the middle.
Okay. Tell me right now, how bad is your pain? On a scale of 0 to 10. 0 being no pain, 10 being the worst pain in your life. And as I mentioned before, Vinodji, right, in my talk, tell me if your 1, 2, 3 is mild pain, 4, 5, 6 is moderate, 6, 7, 8, 9 is severe. It's going from moderate to severe, and 10. And this is all according to your own perception. So what your 10 may not be my 10, but still pain is personal and I have to treat the pain according to how you perceive it. So tell me right now.
So I'll tell you a little bit.
You don't have to tell me really, just you can actually imagine and say it. You don't have to actually say it. You know, this is a demonstration like I was trying to explain.
Usually in a doubt situation, I put 5 or 6. So.
Good. So when you tell your doctor 5 or 6, his understanding will like, okay, not too bad. It's moderate pain at rest. So this is how the pain rating scale is going to be used to understanding your pain. Do you get it? Don't worry. Even when you're in doubt, I'm not sure. I think a 5, maybe a 6. Right? You can tell him exactly how you feel.
So sometimes I feel, should I say 7 or 8 or not? And that's what I want to find out. What in a typical sense, like let's say now I'm sitting on a chair. When I get up, I know I'm going to get severe pain there. And then as I start walking, it'll kind of reduce a little bit, or I do something and it'll reduce. And then I might be, so when I rate it, I sometimes find it difficult.
It is very difficult to rate pain, but however, you just do your best. Okay. It is only to understand. You're trying to convey how much pain you have. Supposing you go to your doctor and say, doctor, I have fever. I feel feverish. Oh, really? He'll put a thermometer in your mouth
Yeah.
and he'll say, not really. Oh, yes. But we don't have that instrument for pain. So we are
Right.
just using it. A ballpark is enough. If you tell the doctor, maybe a 7 or a 8, but be very honest, because that's how he's going to treat your pain. You know, how strong the medication should be, or how much of a evaluation is going to do, you know, his assessment. So be open and frank about it. So it's important thing is have a discussion. I hope this gave a good understanding how you use the numeric rating pain scale. It's not an exact science.
Exactly.
Did that answer your question, Vinodji?
Thank you. Yeah.
Do we have any more questions, Gomati ji?
I don't, I think we are getting closer to the timeline, Sangeeta, this time.
One question from Aparnaji.
Yeah.
I can answer
Yeah,
that.
yes, yes, please.
Yeah, so she's saying that on count of used during the breathing, you had indicated we skip 4 in the count 4 pause for transition, but the count rhythm did not give us time for a pause.
Yeah, so if I can explain, it was 1, 2, 3, 5, 6, and I was expecting 1, 2, 3, 5, 6.
That's the magic. That's the magic, because it is an empty state, right? So you're trying to focus. Where is that 4 missing? It is a timeless state. So during that time, when you bring your brain into 1, 2, 3, oh, 4 is missing. Immediately, what happened? All the thoughts goes away. It says in meditation, between each thought there is a pause, and we miss that because those thoughts are so interwoven. One thought after other, one thought after other. That thoughtless state is a timeless state, right? So when you put an attempt, you close your eyes and do 1, 2, 3, 5, 6. Oh, I'm missing that 4, missing that 4. What happened is the shraddha, the attention start tuning in. That is the purpose. Okay.
I think it served the purpose then.
Hari Om. So we are actually past time. At this time, I would request anybody in our attendees, in our audience, is celebrating birthday today, month of March. You can put up your hand. Is it Lalita ji? Is it your birthday? Did I see your hand go up? I don't have both the screens. How about January? We didn't celebrate birthdays in January, in our January session or February session. So if anybody, January, February, you can actually unmute yourself.
We don't have to know the age. If it's
No, just birthday.
Your birthday, we can sing.
Yeah, the age revelation is not required.
It was your birthday in March, Sangeeta ji.
Yeah, then we should sing it.
You were so blessed. This time it was on Shivratri.
Neelam ji, I actually forgot.
Oh, me too. Once I had on Diwali and I also didn't remember.
No, I'm asking March birthday. I remember, yeah, everybody wished me and I was so grateful and thankful. But when I'm asking, I didn't really remember it was my birthday, but thanks for reminder.
Yeah.
Then we should sing then.
Yeah, is Aruna ji, I see her hand in the screen. Maybe it's her birthday too. So I think it's one day before my birthday is International Women's Day. So we will celebrate all the women and celebrate, when they are also giving birth to children, right? I feel like we should celebrate them that day as their birthdays too. When it's my birthday, I feel like celebrating my mom's birthday, because that must have been, in India, they say it's a rebirth for women when they have a baby. So maybe we can use this as an excuse so that I won't be the only one, receiving all this celebration. So let's all celebrate. Is Medha ji still with us? If not, then, I mean, please, who knows Janmadina Medha? We can sing.
Some of us know. I think Vinod ji knows.
Okay, and why don't I invite Vinod ji to sing Janma Dinamidam, and then I think we all should mute ourselves so that it does not echo. Vinod ji, please unmute yourself and lead us with Janma Dinamidam, but all of us can sing even though we are muted.
Janmadinamidam ai priya sakhe, Janmadinamidam ai priya sakhe, Shantanotu te sarvada mudam, Shantanotu te sarvada. Prarthayamahe bhavashatayushi, Prarthayamahe bhavashatayushi, Ishvara sada tvam cha rakshatu, Ishvara sada tvam cha rakshatu, Punya karmana kirtimarjaya, Punya karmana kirtimarjaya, Jivanam tava bhavatu sarthakam, Jivanam tava bhavatu sarthakam, Janmadinamidam ai priya sakhe, Janmadinamidam ai priya sakhe, Shantanotu te sarvada mudam, Shantanotu te sarvada mudam, sarvada mudam.
Yeah, thank you, Vinodji. Next time, I think we should also maybe play a recording. That will be great. At this time, I would like to recognize our Shiva Veluji, who's actually the director of our Vanaprastha program for our Chinmaya mission. Shiva Veluji, I request you to say a few words. Hari Om.
Hari Om Sangeetaji. Hari Om everyone. Hari Om Medhaji, Satyaji, and everyone. It's so nice to be part of this group. The program has been very well planned and nice topics, and it's a combination of all the things what Vanaprasthas need. And starting with what Medhaji said, gliding into Vanaprastha also for the Grihasthas is so important. And I always say, retirement planning is not for the retired alone. It is for the people who are going to retire also. So I'm so glad that, you're all planning it so nicely, and I'm very, very glad that I was able to join, and all the very best. Hari Om.
Thank you so much, Shivaji, for joining us and for your kind words. So with this, we are going to conclude our program. But before we conclude our program, I would like to remind you that our next Vanaprastha program is April 24th, same time, 5 to 6:15. We go a little bit over, but the topics will be the same, Vedanta, yoga, and health session. But we are also planning to add more interactive sessions in our open mic session. So that's going to be a surprise. That's a surprise factor. And so you have to come back and join us to see what that is. So until next time, I would like to conclude with our closing prayer. Om Sarve Bhavantu Sukhinah, Sarve Shantu Niramayah, Sarve Bhadrani Pashyantu, Ma Kaschit Dukkha Bhavet. Om Shanti Shanti Shanti. Hari Om Shri Guru Pyo Namaha. Hari Om. Hari Om.
Hari Om. Thank you.
Hari Om.
I just, one little thing. I just saw Dineshji post this in the chat. It's please email your email ID to us to info@chinmayasomnath.org so that we can distribute flyers of our upcoming programs. And also could send you surveys to get feedbacks for our future programs. So it's very simple to remember: info, INFO, at chinmayasomnath.org.